Hi, in the previous video I talked about how diabetes affects your feet. In this video, I'm going to share some tips and tricks on how a diabetic patient should take care of his or her feet. This video is meant for patients with diabetes or their caregivers and is intended to give the absolute basics on diabetic foot care. My name is Dr. Richard Menezes. I'm a general and laparoscopic surgeon based in Mumbai, and I teach general surgery to medical college students at Sion Hospital in Mumbai. If this video has helped you, or if you like this video, please do remember to click the like button, share and subscribe to my channel. Okay, so in my practice, I see a lot of patients with complicated diabetic foot disease requiring some or the other form of amputation. Now, amputation is a life-saving surgery in which a part of the limb is removed. Okay, and it is very tragic to see so many patients coming and requiring this surgery for a problem that is completely preventable. So I want to talk about, if you are a diabetic patient, what do you need to do to take care of your feet. Number one is you have to look at your feet carefully every day. So you have to make this a part of your daily routine. So it could be a part of your bathing routine or your dressing up routine, but you have to sit down and look at your feet. Look at in between the toes, under the toes, the heel, the sole of your foot. And what are you looking for? You're looking for anything abnormal, any breaks in the skin, any cuts, any blisters, any boil, any redness that you notice, any yellow patch, any patch of dead skin. Okay? And if you find a blister, please do not pop the blister. Go and see your doctor as soon as possible. The thing that happens with the foot care is sometimes you are not able to reach your own feet. In that case, you can use a handheld mirror that you normally use for makeup or whatnot. So use the mirror under your feet and examine your feet every day to look for any of these changes. If you still can't reach your feet with the mirror, then you need to use the help of one of your family members or your spouse or somebody. The next thing to do is you have to moisturize your feet. So wash your feet with lukewarm water and then take a dry towel, dry your feet up and then use a lotion or moisturizer on your feet every day. Second thing to do is number two, you have to choose your socks and your shoes very carefully. So I would recommend that a diabetic patient wears socks at all times. The socks should be cotton socks and you have to change them every day, and the sock should be loose fitting, so no tight socks or no thin socks. It should be a thick sock. And your shoes also should be comfortable shoes, that is, the sole of the shoes should be soft to walk on. They should be ideally made of microcellulose rubber. And if you have any foot deformity, that is, if the shape of your foot is different from a normal shape, then you need custom made shoes. These custom made shoes are sometimes pre-made, but you can get them done for you, custom made for your feet by any occupational therapist. Okay. Then you have to use care while trimming your nails, or be careful while trimming your nails. While trimming your nails, what you need to remember is you have to cut straight across. Do not curve the sides or do not cut the nail too short, and under no circumstances should you cut the skin. If you are going for a manicure or a pedicure, please tell that person also not to cut the skin. Okay. If you notice an ingrown toenail or in a nail that is causing you problems, then please do not try to fix it yourself. Go and see your doctor as soon as possible. The next thing is, avoid activities that injure your feet. Okay, so avoid barefoot walking at all costs. So you will not know if something goes into your foot, and that can get infected and create a lot of problems. Okay, avoid using a hot water bag or a heating pad under your feet. And lastly, avoid stepping into the bath without testing the temperature of the water first. A lot of diabetic patients lose this sensation and cannot judge how hot the water of the bath is. So if that has happened to you, please ask one of your family members to test how hot the water is with their own hand before having a bath. The next thing to do is be sure to get regular foot exams. So whenever you are visiting your doctor, if you have noticed any change in your feet, make sure to point this out to him or her and show the problem. And ideally, your doctor who is treating you for diabetes should do a formal foot exam at least once a year. Now these are tips and tricks of how to take care of your feet, and these have to be done every day without missing a single day if you want to prevent major complications of diabetic foot. Now next I want to share with you what are tips of preventing all complications of diabetes. So one is you have to maintain your blood sugar levels within the normal range. This is very important. There are three ways to remember this: A, B, and C. A stands for HbA1c. It is a special blood test that gives you an idea of how well your blood sugar has been controlled over the last 3 months. And this HbA1c level should be within the normal range by taking your medication sincerely and by diet and exercise. B stands for blood pressure. Now, a lot of diabetic patients also have blood pressure problems. And if you have diabetes and blood pressure, the risk of getting serious problems like heart attacks and strokes increases exponentially. So, your blood pressure needs to be under control or needs to be within the normal range. And C stands for cholesterol, especially LDL cholesterol or bad cholesterol needs to be within normal. Now, what is the normal range? The normal range for you may be different from the normal range for someone else. This depends on how severe your diabetes is and what your age is. So your doctor will give you a treatment plan that is specially designed for you to get these values in the normal range for you. The next important thing is to quit smoking. If you are a smoker, quitting smoking is one of the most important things that you can do to improve your health. Now, this cannot be easy and will not be easy. So, you need to take the help of all the resources that are available to you and make sure you ask your doctor on how to do this. And the last thing is diet and exercise. You need to have a healthy diet. This does not mean you need to have a bland diet. All it means is that you need to have adequate amount of vegetables, fruits, pulses, legumes in your diet, and to cut back on animal products, fat and fatty foods. And exercise. By exercise, I mean you need to have at least 30 minutes of brisk exercise every day. This does not mean just walking. It can include any form of aerobic exercise like gardening also. But 30 minutes every day for most days of the week is ideal. If you follow all of these things, then your diabetes or your sugar levels will be under control and you will be able to live a healthy life without any complications of diabetes. Okay, this is all for the video today. Thank you for watching. If you like the video, please remember to like, share and subscribe to my channel. Thank you.